Hello, class, and now we'll discuss sport and exercise psychology. Sport and exercise psychology involves the study of human thought, emotion, and behavior in physical activity. These are what we call the ABCs of physical activity, that is, affect, which means emotions, behavior, which means actions, and cognitions, that refers to thoughts. The goals of sport and exercise psychology are simply to understand the social psychological factors that influence people's behaviors and performance in physical activity. It attempts to understand the psychological effects derived from participation in physical activity and to enhance the sport and exercise experiences for those who participate in physical activity. It is important to distinguish between exercise and sport psychology. Exercise psychology focuses on the psychological aspects of fitness, exercise, health, and wellness. On the contrary, sport psychology focuses on the psychological aspects of competitive sport participation. Most of you may be more familiar with sports psychology because you have probably heard it in the news or because you have been participating in some form of sports psychology as part of a sports team. What does sport or exercise psychologists do? Often you find them in university settings as university professors. But today, many sports psychologists are service providers working athletic programs, working with athletes and coaches, either in university settings, Olympic settings, or professional sports. Exercise psychology service providers work also in work sites like health promotion or fitness industry, addressing the needs of the people who engage or participate in the fitness industry. Physical activity specialists versus clinical or counseling psychologists. A physical activity specialist is a kinesiology trained practitioner of sport and exercise psychology who focus on education or the teaching of skills to enhance the performance or personal fulfillment of an individual involved in a sport or exercise setting. On the contrary, a clinical or counseling psychologist is a licensed practitioner who provides psychotherapy and consultation for individuals with clinical conditions such as depression, phobias, or anorexia nervosa. These may include athletes and exercises. A physical activity specialist is not a clinical or counseling psychologist. A clinical or counseling psychologist is a person who has been licensed and trained to provide psychotherapy to address mental health issues. What are some of the common uses of knowledge of sport and exercise psychology? All professionals in kinesiology use psychological knowledge and experience in their jobs every day. We do what we do because we have enjoyed doing it in the past. Many of you who are pursuing kinesiology, you do it because you have played sports and you love sports. Some of you are pursuing kinesiology because you want to have your own business. You want to have a business owner. You want to have your own gym. And some of you want to become strength and conditioning specialists because you enjoy working with people to help them improve their athletic performance. All of those is because you have experienced a positive psychological aspect from your own personal experience with physical activity. For example, physical education teachers use different forms of motivation to hook students. Coaches motivate players and nurture strong team chemistry. Athletic trainers use psychology to help athletes recover from injuries. Corporate and personal fitness coordinators use psychology to get people to start and to continue to be physically active with the programs that organization offers. And recreational and elite sport managers use strategies for effective leadership. When you enjoy something and you do it many times you develop mastery, and that mastery give you perceived competence that you could do it in any setting regardless of the conditions. Sports psychology understand that. Exercise psychology understand that as well. Therefore, what we often want to do is provide positive experiences for people so they can continue to be physically active. There are six main areas in which sport and exercise psychology works: personality, motivation, energy management, interpersonal and group processes, developmental concerns, and intervention techniques for physical activity enhancement. Sport and exercise psychology is related to sport and exercise performance, excellence, and enhancement, and is related to the adoption and maintenance of physical activity behaviors for health benefits, whether it is in a sport or non sport setting.